one more last time, show me.
No. Finished.
Okay.
Namaskar, I'm Ashok Vyas. Welcome to this edition of Wide Angle with Ashok Vyas. And today we are going to be talking about something which is very, very close to our heart, our life, something which concerns us as we see some of our friends, some of our family members at times facing that disease which brings a lot of fear in our mind, that is cancer. How about meeting someone who has not just learned how to take care of cancer, but has reached to the zenith of his expertise, which brings him the title of world-renowned oncologist. And it is not just people saying about him, it is a lot of organizations which are known in this field having evaluated over 100,000 oncologists reached to the conclusion that he is the top living legend in the field of cancer specialists. There is much more to this gentleman, but before I introduce him to you, I also want to share that recently he came up with this autobiography, which was published in Telugu and I believe in English also. We are expecting more interesting for us, making use of all his knowledge. He is appointed as advisor of Andhra Pradesh government in India. So we will be learning a lot from Dr. Nori Dattatreya, Padma Shri Dr. Nori Dattatreya. Namaste, Doctor. Welcome.
Thank you, Ashok. Thank you.
So as I look at you and I seek your attention, when you pay attention to cancer, the way the situation is unfolding in India, what is your reading, and when you compare that with the world at large or with America, or staying with India specific, your general impressions about cancer situation in India?
Thank you, Ashok, for inviting me to the studios. I think cancer situation in India needs a lot of attention by the government, local government, central, and the non-NGOs. Once it looks like we are coming out of COVID situation, hopefully, so we cannot ignore how serious the impact of cancer is. We see in India about 1.2 million new cases every year, out of which about 750,000 people are dying of cancer every year.
Oh man.
Then, if I translate that to more understandable numbers, about 1,300 to 1,400 people are dying with various cancers every day. And it comes to females, which is one of my important, interesting area. 200 women, it could be mother, sister, sister-in-law, anybody. 200 women are dying of cervical cancer every day. So these numbers are alarming if you pay attention to that.
Absolutely.
So I have been giving presentations, video interviews, TV interviews on advances in cancer. And what I wanted to do, how can we get an upper handle on this situation? So with my new appointment as advisor to government of Andhra Pradesh, and also I held other positions at the central government before, my goal is at least certain cancers, I want to make them history. For example, cervical cancer. Why I am emphasizing cervical cancer is cervical cancer, where 200 women are dying of this cancer every day, is a preventable cancer. Number two, it is detectable early stage. It is treatable and it is curable. 4 things. Still 200 women are dying. So we had to go into the basics why this is happening. And if this happens for any, if there is a low-level war between two countries, about 200 women, 1,300, 1,400, your citizens dying every day, you declare a big war. So it's time for us in India that we should take this very seriously.
So talking about the seriousness, even a cursory look at the data which you have just shared, any common viewer would feel alarmed and would be thinking, if it is preventable, why steps that would help in preventing it are not being taken. And forgive me for saying what I'm saying is, they should not wait for Dr. Nori Dattatreya to come up with recommendations. There must be people who are aware of this data and what is the action that, to your knowledge, they are taking.
Yeah, I think they're doing a lot in central government. For the first time, our central government has established National Cancer Institute on par with our NCI in America, in about near Delhi, to do all the activities that we are doing in America. Prevention, early detection, screening, advanced care, translational research, all they're trying to do that. My recommendation, suggestion to them is you have to accelerate, because you have a late start. You have to accelerate these programs, otherwise you will never be able to win the race. I'll give an example for that. There are 1.2 million, I told you, new cases every year. The projections, both from India and from Globocon, it's a global organization of cancer, is by 2030, which is not too far, this number, 1.2, will become 1.8 million.
Oh man.
In India. Are we prepared? Unless you implement all these early detection screening programs, you will never be able to cut down that number. So this is like a wake-up call. So I want all the governments, private organizations, NGOs to pay attention to this and participate in these early detection screening camps. And luckily we do also have vaccination available for cervical cancer. You heard from the news last week from UK. This vaccination of girls between 12 and 15, you can completely eliminate the occurrence of cancer of the cervix lifetime, just like polio and other. So that so 3 states in India made that a mandatory. We have to apply this to the entire country too.
So when I say so, sometimes you ask questions and you feel that, is it correct to ask this? Will it be offending? But as you sit for a television interview, you ask questions which you may not sometimes in person. So taking the advantage of sitting with you for this interview, you have been appointed as advisor of Andhra Pradesh government. Now, as a common man, I don't know whether you have any authority to actually make some tangible changes in the policy formation of the government, whether it is just a decorative position or it has some teeth or at least some power to persuade the way things are moving.
Yeah, I can always provide them with recommendations, strong recommendations. And I can also show them what will happen if they don't follow the recommendation. And I'm taking the message to the public. So the government has to pay attention to it.
So is there any frequency of your interaction with them which is sort of planned?
Yeah, I'm calling them on the video call and phone call. But this advisory position I'm taking as a footing.
Right.
To send my message to the entire country. Just looking at Andhra Pradesh is not good enough.
Correct.
The entire country, other states are in the same boat. So whatever programs I am planning to advise Andhra Pradesh, will be applicable to the entire country. And I am also working with other states too.
Now let's look at anybody who is watching you, who wants to learn why and how cancer. You mentioned about the number which is staggering, and if it is preventable and if we know that these are the things that we should stay away from, probably that would help. So indirectly you might be doing a great service if one of our viewers pay attention to what you are about to say. So let us begin. How and why cancer?
Yeah, how and why cancer? A very important question. I try to put that in a simplistic way to understand. For any normal cell in the body, there are cells in the skin, in the mouth, everywhere. Any cell, it takes 10 mutations to become a cancer cell. Unfortunately, you don't need 10 mutations if you're adding some toxins in the body. For example, cigarette smoking, fatty diet, low fiber diet, low fiber, high fatty diet. These insults on the cell, we call insult. The cell doesn't have to go through 10 aberrations to become cancer cell. In 3 to 4 aberrations, it becomes cancer. So that we need to pay attention to, as I mentioned to you before. If you want to keep away from cancer, you have to follow, any individual should follow certain guidelines. One thing is, being in the field for more than 5 decades, one thing I can say is cancer will not happen all of a sudden. It was not there yesterday and you have a stage 4 cancer today. It won't happen. It is giving you signals in the body which you ignored it. So if anybody wants to keep cancer away, follow certain guidelines. Number one.
Okay, so, yeah, sorry, when you say it is giving signals, we are trained normally to overlook if there are some signals. We say, no, theek hai, hota hai, chalta hai. I mean, it's okay, I'll be fine. That is the normal attitude, and many times that attitude is encouraged by parents. I mean, I'll say it with love and respect, but my father was also like that. He said, no, this is okay, this is okay. I mean, and that used to help actually. So when you say pay attention to your body, and if you start paying too much attention, that then you would not be functional also. That is one side of it. And of course, what you are saying, why I bring it up is because many people are playing with this sort of a mindset. So when you say pay attention to your body, I mean, what kind of symptom that one should pay attention?
Pay attention to the body still is a good thing to say to public. That is, pay attention to the body if something is not resolving within weeks or months.
Correct.
Pay attention to your body if there is a persistent cough not going away month, second month, third month. If there is a difficulty in swallowing foods, first with liquids, then with solids, pay attention. The body is telling you something, so there is an obstruction. If there is a bleeding from the rectum, this is not hemorrhoids, and you watch it, it's not going away, pay attention. If there is a discharge or bleeding in gynecological females, not going away, it's not periods, it's something else, pay attention. Anything that is persistent, that you think is going beyond the limits of normal range, weeks or months, pay attention, seek medical advice. That's what I mean by that. Don't be alarmed by, if I have a cough for 1 week, observe it. So the body gives you signals. Pay attention to the signal.
Yeah. So pay attention to what Dr. Nori Dattatreya is saying, and why you should pay attention, not just because you already feel that he is a compassionate, world-renowned oncologist who is out there to share the wealth of his knowledge, and pay attention to the achievements that have also followed him. He is known, as I probably mentioned, as living legend in the field of oncology. Oncology Society in India. He is also Professor Director of Cancer Center, Manhattan here in New York. He is Chief of Service Memorial Sloan Kettering Center, and he has published 4 books. So along with taking care of patients, he has always been very, very focused on the academic side of cancer research. He has published 300 scientific articles, and of course, he is also one of the founder of 600 Bad not-for-profit Baswa. I'm mixing up the name here. Baswa Tarkam, Indo-American Cancer Institute, that is in Hyderabad. And Dr. Saab, with this additional information that is a part of who you are, may I request you to say something about the advanced research in cancer?
Yeah, I'll elaborate on that, but I will continue with the first theme.
Sure.
We just checked on one.
Yes, yes.
To keep cancer away, one is pay attention to your body, signals.
Correct.
Second one is pay attention to your family history. Family history, which will guide you, because you are carrying the gene pool of your family. So whatever happened to your uncles, aunts, there is a chance that you may also be hit with the same type of cancer. So you can be aware of that at appropriate age. For example, breast cancer. If your mother, your aunts have breast cancer, if you, American Cancer Society and Indian Cancer Society recommend mammography at 50 years. If you are high risk family history, start at 45, not 50. So everything gets preponed. In fact, if I go a little on the side discussion, the breast cancer in females in India, the age is shifting more and more towards younger age. So recently, Indian societies, Cancer Society, have moved the age of mammography to be done to 30-40, because we are seeing number of cases of younger women getting breast cancer. So that's important. Then, after paying attention to your family history, keep away from any kind of tobacco products. In India, 60 to 70% of cancers we see, head and neck, mouth, tongue.
Gutka has also been a cause.
In any form,
Yes.
any form of tobacco. 70% are caused by tobacco. So keep it away from your life, tobacco. No question about that. There is no ifs or buts about it. The fourth one is pay attention to your diet, what you eat. Heavy fat diet will give trouble to prostate, breast, ovary, uterus, everywhere. Heavy fatty diet. I told you that before. It takes 10 mutations for a normal cell to become a cancer cell. I'm sure everybody understands what is a mutation. If a female is fatty and there is inflammation in the breast because of fat, heavy fat, you don't need 10 mutations. In 3 mutations, you will get breast cancer. So watch out for the diet you eat. High fiber, low fat is important. And as everyone says, exercise is always important because it keeps the body in shape, and then keeps away from some of these hormonally related cancers, breast cancer, prostate, colorectal, ovary, uterus, all those cancers.
You know, allow me to express my ignorance. I never thought that exercise is also so directly related to preventing cancer. I always knew that staying fit is good, and we always connect with heart disease or in order to keep your blood pressure, etc., etc. But it also reaches to the danger of cancer. Now, moving towards the other reference of advanced cancer research.
A lot of advances are done. A lot of significant research is done in advanced treatment of cancer. We started with radiation, chemotherapy, and surgery as standards of care in cancer treatment. But now you have targeted therapies, you have immunotherapy, and you have so many advanced technologies, molecular therapies available today. And it's important for everyone to know that cancer diagnosis is not a death sentence anymore. If properly treated with appropriate treatment, there is excellent chance of surviving and curing the cancer.
That's a good news.
That's a good news. That's a good news. Tremendous news. Tremendous news. I think I can explain in a simple way that 20, 30 years ago, our understanding of cancer was very primitive, even here in the US. With these designer drugs, targeted drugs, specific to block a marker, you can cure a lot of cancers. For example, the chronic, the CML, you can cure with a simple pill. And a stage 4 cancer, with simple pill, if there is a mutation, you can cure them, you can give them a prolonged life. It used to be 6 months to 1 year before, now they can go for 10 years without any problem. So immunotherapy is another major breakthrough in cancer treatment. Immunotherapy works on multiple receptors on the cell, and then it will break the molecular shield that is produced by cancer cell around the cancer. It will break the molecular shield. One simple example of how significant that is our past president Jimmy Carter has melanoma on the skin, and this is a public news, so I can share with you. That cancer has metastasized to his liver, his bone, his lung, and his brain. And he's treated with a small amount of radiation and immunotherapy. And he's going without evidence of any cancer anywhere in the body. And this is, if I'm not wrong, it's 8th or 9th year.
Wonderful, wonderful.
So these are the breakthrough treatments, incredible treatments that are available today. And these are available in India also.
So, Doctor, we always look at the limitation which we have, even for the time that we have with you for this conversation. And we also long for that which is limitless. And I refer to the spiritual dimension. You, in addition to being what you are as world-renowned oncologist, have paid attention to the spiritual dimension of human beings, and you have been instrumental through your Nori Foundation in founding 3 Sai temples, one at Baldwin, one at here in New Jersey, and there is another one at Hicksville. We are now in our new studio at ITV Gold here in New Jersey, and let me request you, as I am aware, in addition to serving the devotees, find a place where they can get a sense of shelter. This is also serving the society. As an oncologist, connecting with your role with the temple, there is a new initiative that here, which I heard you have in your mind. Talk to us about that, how you are helping.
Thank you, Ashok. This is the first time I'm trying to announce being an oncologist for a long time, and temples, 3 temples, mandirs for Shirdi Sai Baba, doing a lot of community activities. I would like to provide to our Indian citizens in America, Indians in America, at Hicksville Mandir and Island Mandir here, a second opinion consultation for any patients you may have in India or your own relatives here in America. You can call my number.
I'll read out the number which you may make note of if you need second opinion and you would be advised to go with your papers to the temples, and you can definitely find more details from 914-320-5925. And it is a great opportunity for anyone who needs it, and those who need it, they know how valuable it is to get a second opinion from someone like Dr. Nori Dattatreya. And you can also reach out to him through his email ID, which is noridatta@gmail.com. And as we just have 30 seconds to go, your concluding message for our viewers.
A concluding message is cancer is not hopeless. There's tremendous progress made. And again, look, if you have any symptoms, don't ignore them. If you detect the cancer early, you have 99% cure rate. So don't sit on any symptom that's not being resolved. And in America, we have the luxury of any medical insurance. They provide free mammography, ultrasound for prostate, PSAs for males. They're all included in routine examination. Get it done annually. If they are all negative, you can wait for 2 more years to repeat the test. So there's a lot of good news in cancer, nothing to be frightened. And if you need opinions, please seek opinion from other doctors. And I mentioned I'm available if you need.
Wonderful. My guest today, Dr. Nori Dattatreya, world-renowned oncologist, who is also now serving as advisor to Andhra Pradesh government, and he is very passionate with his expertise, compassionately working to increase awareness and where it is preventable, he wants all of us to focus and act. And one act which I think any one of you and me can always do is pay attention to your body. And paying attention is paying respect. So respect yourself is one way of translating what we heard from Dr. Nori Dattatreya. With a lot of respect and love for you, sir.
Thank you, Ashok. Thank you.
Thanking him and thanking all of you with lots of good wishes. This is Ashok Vyas. Namaste.